Yes, so hi, my name is Anou Souvanavong. I'm from HISP Vietnam, but I'm based in Laos PDR. So my role at HISP Vietnam is data communication officer. I'm like advocate in terms of data use and supporting Ministry of Health in Laos in terms of data analysis and data use. And I'm also climate and health focal point for HISP Vietnam as well. So today, here in Oslo, I'm presented in my project, the dengue early warnings and its potential use case in Laos PDR. In Laos, we call it potential use cases because climate and health is quite a new field for Laos. So we're trying to find a way that we can integrate it, climate data with health data, and trying to find a way to improve our health information system, especially our early warning system with climate data. The challenge that we have found so far is that this is the first time that I've worked outside of Ministry of Health, so I've got to learn a lot about what happened at the meteorological department, namely within the Ministry of Natural Resource and Environment. So we kind of see the way that other ministries doing their work, their resources, and how can we work with them, and also at some point help them in terms of like IT as well. Especially when you are working with climate data. This is such a new field for us, like for me, for my team. So we have to understand the domain knowledge of climate. So we have a lot of meetings. We have study tour back at the meteorological department in Laos, trying to understand what the data is all about. For example, we thought that they record all the temperatures or the rainfall in numbers, but no, they record it in codes, and you have to translate it first before like enter it into the system, something like that. So yeah, so this project is it came up because we have this kickoff workshop, like climate kickoff workshop in Laos, and we have a lot of all stakeholders trying to discuss like which disease that we should aim for this early warning projects. We came up with dengue because for us and for our stakeholder, it seems like they are the one that have like a good data set. We would say the good quality. So that's why we decided to go with dengue. However, we are also working a lot with the modeling team, trying to get the modeling app working, trying to get some data product for the stakeholder to look at to see that, okay, this is what our system can produce and whether is this enough to fit into the system. So that's why going forward, since we got everything working properly now, so we try to involve more stakeholder in terms of like data improvement. We still have some data that we need in our system. For example, intervention data. We don't think climate is just enough because sometimes we see a drop in dengue cases and we don't know what the locals has been doing in terms of like prevention control. So we try to integrate those intervention data into our system. So that's opportunity going forward for us. Next is, as I said, climate and health is really new. And we have the challenges of novelty of concept where, for example, like the epidemiologists, they still don't know how can I include this climate into my work. They're still working quite with climate, not that much. So we will try to show them like what data product that we have, try to give them like maybe this is useful for your work, and we try to integrate them into the routine system, especially the early warning system. And lastly, of course, as climate is very new, and to develop a new early warning system to pilot them at the local sites, we need some kind of trainings. In Laos, we really need this. This is very new for us, and we really need a lot of experts to come and work together and try to come up with a good curriculum to train people to know how to work with climate and health data, because I don't think it's useful or beneficial for us to train them everything about climate. So I believe that the curriculum should be very precise so that these health workers can work on climate and health easily, so they don't feel like this new information is a burden for them. We have to supplement like what they're doing. So the outcome that we hope would like to see is like personally, I always aim for data-driven actions. For right now, not even in climate, people still working like traditionally, like still the same way, still believe in hunches and yeah. So I want people to believe in data, to believe in what they're doing. It is gonna take times, especially in things like prediction or forecast. Like it's not gonna give you 100% accuracy. Like we know that, but we just hope that this dengue early warning system can supplement health workers in the work that they are doing. So like if it really helps, I think in time, like people will start to believe in the data, start to look out for data. They start to ask like, where should I go with this? For example, like we have our key goals where we want this early warning system to give people like a sign where you say like, okay, this health center A, there's going to be an outbreak of dengue. So all the resource mobilization should happen before the outbreaks happen. Um, also, it also gives people a signal to do prevention controls. And lastly, we want to equip our health workers with more skills. It not necessarily have to be just climate and health. So when you educate people or train people on how to use data, how to look at dashboards, how can you use this data for actions, then it can also be applied to other fields as well. At this project, I think a lot of our colleagues are talking about that all the stakeholders have to be involved. You were asking me like, what's the surprise thing that I found like working on this project is the amount of stakeholders that we have to work with. We have to work with the Ministry of Natural Resource and Environment. We have to work with any new partners, new donors. We also have to work with not only just the climate side, we also have to work with the health side. And then we also have to try to talk and explain to the health side, this is what we are doing on the climate side, and also like vice versa to the climate side as well. So I believe that all stakeholders should come and understand each other and work together. It allows like during my experience working with HISP, I believe that having a clear role and responsibilities for each stakeholder is very important because Laos is we have scarce resources and sometimes like we work at the same thing at the same time for the same results. So I think that that's a waste of resource and time. So I think that for any stakeholder or any partners who want to work with in climate health in Laos, so please try to contact the people who are still doing climate and health works in Laos. For example, Ministry of Health, Department of Planning and Finance in Ministry of Health, so that you can learn what's happening in Laos and how can you intervene or how can you supplement the work that we are doing right now. Because we believe that climate and health is a very important project and we know that there are resources going around, but we want to use all these resources as efficient as possible.